In Manila's streets they roamed alone, till the mentor's voice gave them a home. From the islands to the globe they flare, wings of care spread everywhere. From night shifts under neon glow to dawns where new potentials grow, with stethoscopes and dreams they soar, bringing healing to distant shores. Nurses rising, lighting flames, heroes carrying countless names. From the Philippines they find their stride, touching hearts and saving lives. In the quiet mornings they recall a guiding hand that moved them all through exams and doubts that pierced their mind. They found purpose, one of a kind. And they wear their scrubs like capes of might, stand tall in challenges day and night. From the barrio to the world at large, leading change with every charge. Nurses rising, lighting flames, heroes carrying countless names. From the Philippines they find their stride, touching hearts and saving lives.
Our speaker holds a higher education teaching certificate from the Derek Bach Center for Teaching and Learning at Harvard Graduate School of Education, where he also obtained a training certificate in online facilitation. He is a member of Harvard Business Review Advisory Council and opt-in research community of business professionals. He finished a program on artificial intelligence from the University of Oxford. He finished his Master of Education and Learning, Design, and Technology and Post-Baccalaureate Certificate in E-Learning Design at the Pennsylvania State University, where he finished both courses with a GPA of 4.00. He completed his training on the ecosystem approach to designing and implementing outcomes-based education from the ASEAN University Network in Thailand. He finished his Bachelor of Science in Nursing cum laude and Master of Arts in Nursing summa cum laude at the University of Santo Tomas. He was a board top-notcher in the Philippine Nurse Licensure Examination, where he obtained a rating 89.20. He is a recipient of two doctorate degrees honoris causa from two state universities in the country, the Ramon Magsaysay Technological University and the Pangasinan State University. He co-authored a book on technology integration in teaching and learning entitled Collaborative Virtual Instructional Designs for Teaching and Learning Nursing. He is the author of nclex-pn in a flash published by Jones and Bartlett, USA, and Mosby's Essential Concepts for the Philippine Nurse Licensure Exam published by Mosby Elsevier. He is the proponent of the functional concepts method, a teaching pedagogy for international licensure exams. He is the inventor of several game-based apps and a consultant of various international firms and educational institutions. He is a multi-awarded entrepreneur and author. Among his numerous awards are the Manny V. Pangilinan MVP Bossing Award for Education, the SMEIT Award for Innovation from the Philippine Internet Commerce Society, the AGRA Award for Entrepreneurship from the Philippine Marketing Association, the 10 Outstanding Filipino Entrepreneurs Entrepreneur 10 from Entrepreneur Magazine, and the Young Market Master for Entrepreneurship from Mansmith and Fielders. He is also the first Filipino nurse entrepreneur to be accepted as part of the Ernst and Young Entrepreneur of the Year Academy. In 2005, he was named one of Go Negocio's first 50 inspiring Filipino entrepreneurs, and in 2006, the Philippine Graphics magazine's Young Leaders of the Philippines. Also in 2006, he was co-listed with Bill Gates in the 25th edition of Marquis Who's Who in the World. Currently, he serves as a trustee of the Philippine Center for Entrepreneurship PCE, an advocacy group under the Office of the President. Ladies and gentlemen, Dr. Ray Agapuz.
Welcome, dear colleagues and our dear friends from the nursing profession. Those of you who are dreaming to become USRNs and you want to turn that great American dream to reality, you came to the right place at the right time. We're here to assist you and inspire you to turn that great American dream to reality. Anyway, we're also going live through Facebook. And those of you who are watching us from Facebook, welcome to the first step towards your great American dream. Anyway, before anything else, I'd like to welcome the USRNs to be. And yeah, good evening, Ligaya. Good evening, Maria Teresa. Could you please type your location where you are in the world? At your service is Mentor Ray. I'm a licensed nurse in the United States, and I've been a test preparation coach for the NClex-RN since 1994. That's a good 32 years of my life. So we have people coming from, Antique, Angeles, Guam, USA, Bicol, Marilao, Trinidad and Tobago, Trinidad and Benguet, Seattle, okay, Binyan City. Okay, welcome, welcome, and welcome. So I'm the author of nclex-pn in a Flash, published by Jones and Bartlett, USA, and I'm proud to say I'm the first Filipino to have authored an NClex preparation guidebook that has been tagged in its launching year as customers' favorite in Barnes & Noble's USA. So thank you very much for those who patronize my book. Now, what I did is actually to talk to my publisher so I can have a local version of the book. It's now entitled nclex-RN 311. This is the NGN or the Innovative Edition, which we're going to raffle copies and in a little while, okay? And of course, we're also giving away free PDF copies of my book for those who are joining us live, okay? Jamie Asuncion, if you have any appointment, if that appointment will not give you $250 an hour, that's now the pay of nurses in the US working as travel nurses, drop that goddamn appointment. Nag-uumpisa pa lang, you're asking if there's a recorded video, there will be none, okay? So you have to join us live, okay? So what is inspiring about the book? Okay, so I have here a lady. I haven't met her personally. Her name is Teresa George, and she's from Maryland. And her story, she failed the NCLEX 9 times. On her 10th try, she read my book, got a copy at Barnes & Nobles in the US, and she passed after that. Okay, so let's read her success recipe. I seriously read the book for 2 months. Then I bought nclex-RN in a Flash at Amazon.com because it was all sold out at Borders and Barnes & Nobles. I really just read the book and studied harder. Finally, I found a way in attacking the questions. The contents of the book are actually the items that actually are being tackled in the actual exam. I'm not the one saying. So what she's saying is, let me read that again. The contents of the book are actually the items that usually are being tackled in the actual exam. I'm not the one saying, it's the users. Let me just tell you, I don't really like reading that much, but this book made me addicted to it. With prayers and serious study habits, I passed the test on my 10th try. Okay, a way to go. I'm not ashamed on saying I took it 10 times. It is my way of encouraging people that there's still a way of passing. And that's her success story. Welcome to Nurse Chris John, okay, Benevice from Kuwait. Hello, sir. Welcome to our session. Okay. And wag magpakanega, yung iba umpisa pa lang, nagtatanong na may video. There's none. Okay? Excellent. Okay, let's move on now to what's unique about the book. Now, the book presents the concepts in a flowchart manner. That's trademark of the Ray A. Gapo system book. So, those formats are actually important, okay, for you to remember. Why? Because this is the one that enables you to relate concepts to questions. So in other words, the book is in this format. So you have a concept and you have to apply that concept to a question. The answer is provided and you have a rational and you have some pointers on the left-hand side, lower hand side, left corner. And this format has enabled hundreds of thousands of nurses from more than 36 countries now who are using the system to pass NGN on their first try. You could be the next one. Okay, so anyway, here's a good feedback from another user of the book. I asked which book helped you the most, and she says nclex-311 is the best. And I asked why. This is what she says in Tagalog. Halos same na same po siya sa pagkaka-construct sa mga na-encounter kong mga stand-alone questions. I'm not the one saying. What she's saying is, in English, the way how the questions are constructed in the book is almost the same as that in the actual test. So, those of you who have yet to get a copy, those who are joining us today, you're gonna get an ebook copy of my NCLEX 311 book. And those of you who are lucky enough to get into our program through scholarships that we're going to raffle off in a while, please do stick around until the end of the class. I promise you, this is one hell of a session. Okay, so here we go. Here's another feedback from the user. Halos lahat po ng mga nasa new 311 book, this is the book. Yung format ng mga sample questions, ganun po yung lumabas. So what she's saying is, the format of the new questions are found in this book. So those of you who have yet to get a copy, don't worry, you're going to get an ebook copy of this book if you finish our session up to the last session that will be facilitated by our excellent 85ers lecturers. So we're talking about functional concepts. What are functional concepts? Now, a functional concept could be a word, a phrase, a sentence, or even a paragraph. So it will enable you to think before answering a question. It gives you a sense of direction. How does that happen? Okay, the functional concept is very unique to the Ray Gapo system. I'm the proponent of the functional concepts. I started studying it in 2008 and has created a whole new manuscript and a new pedagogy in terms of presenting concepts for the NGN. So in a nutshell, functional concepts involves those ideas in chunks presented in a flowchart manner aimed at establishing connections between theoretical concepts and real-life practice as reflected in tests. I found out that most of Gen Z learners, sometimes they're very good at looking for facts, the things that they need, okay? But they don't know how to use it. Say yes, if you do agree with me. A lot of Gen Zers who are about to take the NCLEX know a lot of things. But the question is, do you know which of those things you know you need to focus on and dig deep and expand so that you'll be able to answer your NGN questions? That's the problem. That's why I always tell my students, wag mamaru. Don't be pretentious. That's in our vernacular Tagalog. Don't be pretentious. Don't go there that the only thing you know is myocardial infarction and the only drug you know that is biogesic and the only discharge instruction that you know is say ingat to your patient, okay? Or take care in English. So the most important thing that you have to focus on should be How do I study my lessons? That's the game changer when we talk of the next generation NCLEX. Okay, so if you want me to show you how, here's an example. For example, if you're going to read about diarrhea, okay, it will take you a couple of pages if you're reading textbooks, and that's what you usually do. And if you read through, the more you read through in those literatures, the more that you get to realize that you don't know a lot of things. And eventually, the more pages you read, the more confused you become. And the more confused you become, the more that you don't remember things. Am I right? Say yes. Come on. Say yes in our chat box. Excellent. Thank you very much, Sheena. Thank you very much, Jan Victor. Okay, that's the reality. The more that we read, the more that we forget. Especially so that we were trained in our nursing school. Our curriculum is actually broken. It's fractured. It's fragmented. It doesn't teach us how to study. Okay? All you were actually taught was how to create pathophysiology with all of those arrows. So you ended up just remembering the arrows that goes down. That's the only thing you remember about the pathophysiology that you studied. So for example, if you talk about diarrhea, the topic could be hydration status in a client with diarrhea. Now, which of those concepts about diarrhea do you have to remember? What if I tell you that you only need to remember 2 words, and that is urine output? You'll be able to answer 3 questions, at least 3 questions with confidence and correctly by just remembering those 2 words, urine output. Why? Let's derive it from the functional concept. Here we go. The best clinical indicator of hydration for a client with diarrhea is the urine output. In essence, if you would want to evaluate the hydration status of a client with diarrhea, then you need to focus on the urine output. Okay? Using that in mind, remember, diarrhea, urine output. Okay, so having that in mind, let's try to use that functional concept to answer several questions. Here's the first one. Here we go. A 9-year-old is admitted to the hospital with dehydration. Which patient goal is most appropriate for this child? The patient will, okay, 1, have abdominal skin pumping. 2, have delayed capillary refill time. 3, have a urine output of at least 30 ml in the next hour. Or 4, have a central venous pressure reading above 12 centimeter water. And your answer as fast as you can, as fast as you can. Everyone answered it the second I said go. And all of them are getting it correct. Have a urine output of at least 30 ml in the next hour. That's the minimum patient goal to ensure that the child with dehydration is able to maintain adequate fluid volume in the body. Now, what about your central venous pressure? Well, normal is usually 3 to 10 centimeter water. So if you have less than 3, that could indicate hypovolemia. And if you have more than 10, that could indicate hypervolemia. The fact that you have a CVP reading of 12 in option 4 is not a good indicator of a balanced fluid status of the client, because that indicates excess fluid retention. So the answer is 3. Excellent. Let's take note of another one. A 5-year-old is hospitalized due to dehydration. In caring for the client, it is most important to implement measures to meet which of these goals? Now, the question now is asking about a specific goal: to prevent weight loss, to promote adequate urination, to increase urine osmolarity, or to keep CVP level above 10 centimeter water. Once again, answer the question as fast as you can, and everybody, okay, they get the question right. To promote adequate urination, that's actually number 2. Remember, diarrhea, check the urine output. Now, what if we try to reverse the concept and try a more difficult question? Here we go. Which of the following statements by the mother whose 6-month-old child has dehydration would indicate a possible complication? Now, the question is asking about a possible complication. Okay, so is it 1, my child has dry skin and lips? Well, dry skin and lips may indicate decreasing fluids, but is it definitive of a developing complication? Let's go through the next options. My child sleeps most of the time. Well, this is not directly associated with any fluid imbalance, this could be a normal characteristic of a 6-month-old infant. 3, my child has not urinated the whole day. Or 4, my child has wet 6 diapers today. Which is which? Take note. For infants, they have to wet at least 4 diapers per day. If they have yet to wet 4 diapers in 24 hours, that requires reporting it to a physician or the healthcare provider. So the best answer to this question, I can't imagine everyone is answering, giving me the correct answer, is number 3. My child has not urinated the whole day. Look, colleagues, we talk about dehydration. I asked you to just remember 2 words, urine output. You were able to answer 3 questions correctly and with confidence. Isn't that a wow? Tell me, is this the first time that you are able to discover a pedagogical method that teaches you how to simplify concepts in a functional way? Excellent. Thank you very much, Stephanie. Thank you very much, M. Feliciano. Thank you very much, Ivan. Thank you very much, Dea. Okay, so let's move on and let's get to learn more. So what nurses are saying about the functional concepts method of the Ray Gapos NCLEX test press system, my experience was exceptional. So Ray goes beyond and above what is expected. Kudos to your team. 10,000 over 10, the best lecture na na-experience ko from those who attended the classes. I appreciate every bit of that from the start up to the end of the sessions. I love the humor of Sir Ray and how organized the team is. And of course, the use of functional concepts of Dr. Ray made me understand clearer the topics. These are actually actual feedback by class participants. And I hope anytime soon you'll be one of them, because we're going to invite you to our open house later today. You will know that you will have the opportunity to use our secret formula, why more than hundreds of thousands of nurses from all around the world are passing NGN the Ray Gapos way. That's because we have a simulator, and we're going to allow you to use it provided you meet our requirements, which we're going to tell you, and we'll talk more about in a few seconds. Functional concepts is the reason why the world's oldest, you can ask ChatGPT, the world's oldest NGN passer at age 66 passed the test. So if you are younger than 66, you still have more neurons than Nanay Flor. And this is what she says to everyone. Okay? Sir, talaga ang parang nakaretain sa mga concepts paulit-ulit. Repetition is the key. Kahit hindi ko, sir, masyado naintindihan. Well, because her background is industrial engineering. She taught engineering for 20 years. She had a second course, nursing. Of course, her first course is intercourse. No, actually. And she's also a dual citizen. She's a Filipino citizen and at the same time, a senior citizen. Soon, she will be a triple citizen because she will become a U.S. citizen. But we also have, before her, the record holder was Nanay Pasita Reveal. 61 years old, post-craniotomy. She came to our class. She did an 8-day program with me in Cebu. Okay? You can just imagine the anesthesia that was used. Her first surgery was craniotomy. Okay? The second surgery is that after the craniotomy, because she had ruptured aneurysm, they had another surgery to have ventriculoperitoneal shunt inserted. Okay, that's to manage the excess cerebrospinal fluid that she's having. That's the second surgery. The third surgery, she had thyroidectomy. And the fourth surgery, she had the release of compressed median nerve. Because Nanay Pasita, at age 61, had overuse wrist. Okay? When you have an overuse wrist, you are at risk for carpal tunnel syndrome. Why did she have an overuse wrist? Let me tell you the answer. Because at age 61, Nanay Pasita is still single. So her wrist is overused. Remember? All the single ladies, put your hands up. Kidding aside, colleagues. Okay. I'd like to inspire everyone, if you are younger than these colleagues of ours who passed the test when they became senior citizens, please do send us a note through our group chat. So congratulations, Nanay Flor Pangilinan Villarreal, USRN from Ago Foundation College, Naga City. She passed the test last December 2, 2024. That's very, very recently. And we have a feedback here coming from one of our learners. Actually, parang 90% ang exam ko na discuss po sa Quick Fix. Quick Fix is the 3-day program that you will have with me. Okay? So, that's why I'm truly grateful that I had the chance to attend the class personally. I'm here at our NGN class at the Ray Gapos building in United Nations Avenue in Manila. We have very comfortable classrooms, limited number of students, and of course, we proud ourselves. We have the cleanest restroom among all the centers worldwide. Okay? Sobrang happy ko po and grateful for all the staffs of the RA Gapos. They are so kind and accommodating. Okay. Here's Ver from Cebu. This is what I want to hear from Ver. Gustong-gusto ko po yung case study natin. It geared my mind in identifying diseases without even checking the choices. It helped me a lot during my exam. Also, the trends you are discussing is on point. Let me read that again. The trends you are discussing is on point. We're going to discuss trends today. Okay? It gave me chills reading some questions in my exam which we exactly discussed during the review. Amazing masyado, sir. I'm not the one saying. Look at these professionals from the different parts of the country vouching how good the program is. Okay? May online po ba ang quick fix tips? Yes. Anong date ang closest sa May? Please send us a message after through our group chat. I know, Sir Jason, you could be cramming right now, but we can help you and you'd have to worry about it. Okay? Tama po. Sobrang galing ng review. Thank you very much, Stephanie, for your very kind words. Okay, let's move on. Without further ado, let's get down to business. Let me give you an example of the next generation NCLEX exam. Now, this is one of the toughest question that's coming out as a trend now in the test. It's called matrix. Okay? Sir, yun ba yung pangarap ng mga bading? No, gaga matris yun. This is called matrix. Okay? So a matrix question is going to ask you to compare at least two conditions. And what I'd like to highlight about matrix is, listen to these colleagues, you better be careful. You don't just click and click and click when you're answering a matrix question. Why? Because a matrix question is scored using the right minus wrong methodology. Yes. So at the end of it all, if you're not choosing properly and you're just clicking and clicking and clicking, you might be getting a negative score after all. So don't be careless. Don't be pretentious. Wag mamaru. Don't believe the false prophets of the NGN that abound in the internet and social media. Okay? Some of them have yet to pass the NCLEX, and how dare them talk about how to pass the test. Okay? I challenge anyone who has monitored the NGN, the NCLEX for that matter, for more than 32 years. Look for one around the world. I can lay to that claim. I'm the only one who did that. Monitored the test from the time it evolved into what it is now. Okay? Okay. And that's something that I know is our main advantage. 32 years of experience. Remember, the Ray Gapo system started in Pangasinan with 3 students, where 2 of those 3 students were apathetic. So when I crack a joke, only 1 laughs with me. And when that student gets absent, I laugh all by myself. Okay? That's how we were way back in 1994. But now, the Ray Gapo system is now being utilized by healthcare workers in more than 36 countries worldwide. Okay, here we go. We have a question, sample question on matrix. The nurse is evaluating a client who comes to the emergency department due to frequent loose stools. Which of the following assessment findings are found, this is the keyword, in both conditions? That's the keyword. In both conditions being considered by the nurse. Let me ask everyone. Would you know that you need to study norovirus and rotavirus in this form, trying to compare whether these signs and symptoms are found in either one of them or both of them? Do you know that it has to be studied this way? Real talk. I want an answer. No, that's my point. You don't go and take the NGN if you don't know these kinds of things. Because we weren't trained this way. When we were doing our bachelor's in science in nursing, we were taught to study disease per disease. We were not taught to compare one from the other. Okay, Well appreciated, sir. Thank you very much. No regrets. I've enrolled at RUG-RC. Thank you so much. Okay, let me give you a brief overview. Both of these conditions are viral. Norwalk virus is the same as, norovirus is the same as Norwalk virus because it was first isolated in Norwalk, Ohio in the 1960s. That's where it got its name, okay? Now, rotavirus is also a viral infection that could potentially lead to diarrhea. But whether all of these, I know for what you're thinking, you will put a check on all of these. All of these are found in both. But that's not how it works when you're doing the NGN. So how do we answer this question? Functional concepts to the rescue. Let's have this. Watery diarrhea occurs in both norovirus and rotavirus. Therefore, pay particular attention to the fact that diarrhea is best judged on the basis of consistency. Yes, it's not frequency, it's not on the amount, it's not on the other. It's best judged on the basis of consistency. So whenever you have loose watery stool, then that's considered diarrhea. And what electrolyte is usually lost in diarrhea? Functional concept. Potassium is lost either through the bowels or the bladder. Therefore, if you talk about diarrhea, you are going to lose a lot of potassium. Okay, let's move any further. Here we go. Sudden, watery, and non-bloody diarrhea may indicate norovirus infection, while gradual, profuse, explosive diarrhea may indicate rotavirus infection. Therefore, in both conditions, you have watery diarrhea. The difference is in norovirus, the diarrhea is non-bloody, whereas in rotavirus, the diarrhea is profuse and explosive. Therefore, which of the two now is more severe? It's usually rotavirus because rotavirus diarrhea could last 3 to 8 days, whereas norovirus diarrhea is self-limiting and could only last 1 to 3 days. Okay? Now, since these are both infectious conditions, we expect fever to occur in both. So are we learning so far? Okay? There are a lot of comments here on my chat box. Okay? We're learning so far. Excellent. Okay. So pale, cool, sweaty skin occurs in norovirus diarrhea, while tenting of the skin usually occurs in rotavirus infection because tenting of the skin on the abdomen comes with dehydration that's progressing into a severe fluid deficit. Okay. So that's usually a complication of your rotavirus infection. Now, norovirus diarrhea has low-grade fever. It's shorter, less severe with vomiting, while rotavirus diarrhea comes with high fever and is longer and more severe. Therefore, which comes with vomiting? Norovirus. Which comes with dehydration as a complication? Rotavirus. Which is self-limiting? Norovirus. Which could potentially progress into severe dehydration and could even become fatal? That's rotavirus. Okay? Norovirus occurs in almost all age groups, okay? From people below 5 years old to people above 85 years old. And norovirus, as I call it, is the diarrhea of the social because most of them usually would get norovirus when they go for a cruise. So they get it from cruise ships. Therefore, the transmission of norovirus could be fecal-oral, could be foodborne. Whereas your rotavirus, on the other hand, the most common form of diarrhea in children below 5 or 3 years old, this could be due to infrequent hand washing, or this could be due to the toddlers being exposed to each other in a daycare center facility where there is no frequent hand washing. Now, what makes rotavirus dangerous is the fact that it affects young children. Unlike norovirus, when you have it in adults, it becomes self-limiting. Okay, so once again, norovirus, the diarrhea with the vomiting, rotavirus, the diarrhea that can develop into severe dehydration. Okay, therefore, rotavirus diarrhea carries a higher risk of dehydration in children. So if you're going to prioritize which patient, both with diarrhea, should the nurse attend to first, it has to be the patient with rotavirus diarrhea because the patient could actually go into dehydration and it can potentially become fatal. But the key intervention for both, whether you have noro or rotavirus, would be hydration. And when you talk of evaluating hydration, don't forget the functional concept. Note the urine output. Okay, now, how would you know that the urine output is adequate? Focus on the wet diapers that infants would usually consume. For example, here's a good rule. For newborns, neonates from 0 to 6 days old, for day 1, they should at least wet 1 diaper. Day 2, 2 wet diapers. Day 3, 3 wet diapers. Day 4, 4 wet diapers. And beginning from day 5 to 6, they should wet at least 5 to 6 diapers in a day. And the moment they turn into a week up to 6 months old, they have to wet an average of 6 to 8 diapers per day. So if a child is not having 6 to 8 wet diapers a day, suspect potential dehydration. So it's a medical emergency if an infant has less than 4 wet diapers in a day. Let me ask you now, do you even know that you need to study these concepts in relation to norovirus and rotavirus if you did not come to this class? Real talk. That's what I'm trying to say. That's what I'm trying to say. Don't be pretentious. Wag mamaro. Naniniwala ka sa mga hindi naman pumasa ng NCLEX, again, NCLEX. Okay? So, the most important thing that you have to know the trends, and you have to get it from certified mentors who know what they're talking about. You don't get it from false prophets of doom who are scattered all over social media claiming this and that, and they have yet to pass the NGN. Okay? Okay, so let's move on now. Seek medical attention if a child has less than 4 wet diapers in 24 hours. Once again, 4 wet diapers in 24 hours. Here we go. The good thing about rotavirus is that it can be prevented through a vaccine. And it comes in 2 forms. Rotatec or RV5 is given in 3 doses. The first dose is usually given at 6 weeks. The second and the third dose is usually given 4 to 10 weeks after each of the first set of doses that were given. Rotarix or RV1 is given in 2 doses, and these are given orally through, look at how the medication is infused. It's administered. There's usually 1.5 ml of the vaccine that's given orally. Now take note, what's the usual issue? Can I kiss a child after they receive rotavirus vaccine? The big answer is no, because there could be transmission of the virus through kissing. Okay? And the problem is, if the mom who kissed the baby could be immunocompromised, then they can get the viral infection themselves. Okay? Those are the kinds of things that you need to study if you want to ace NGN at 85. Okay? Okay, so let's move on. So, what is a common contraindication to this vaccine? History of intussusception, the telescoping of the intestines that could potentially lead to current jelly stools described as bloody and mucoid stools that is related to the inflammatory condition that occurs in intussusception. So that's a contraindication to the administration of the rotavirus vaccine because the vaccine can potentially aggravate that condition. Okay, now we go back to the sample question we had a while back. The question is, which of the following assessment findings are found in both conditions being considered by the nurse? Okay, watery diarrhea. Do we have it in norovirus? Yes. Do we have it in rotavirus? Yes. So is it found in both? Yes. So we put a check. That's the way to do it. Projectile vomiting. We only have it in norovirus. We don't have it in rotavirus, just in noro. High-grade fever. Well, high-grade fever is found in rotavirus because in norovirus, you have low-grade fever. So the question is asking found in both. Severe dehydration, we only have it in rotavirus. Okay? Norovirus usually doesn't lead to severe dehydration. The key word there is severe. Weakness. What did we say in our first functional concept? When you have diarrhea, you're losing potassium. Muscle weakness. is a manifestation of potassium imbalance. It occurs in both hypokalemia and hyperkalemia. So shall we put a check for muscle weakness for both norovirus and rotavirus? Yes. So your final answer should look like this. You don't go there and take the NGN without you knowing how to differentiate norovirus and rotavirus. Let's have real talk. Is this how you are studying your concepts at the moment? Yes or no? Tell me, honestly, is this how you are studying your concepts at the moment? That's my point. If you are not studying the concepts this way, don't ever dream of acing NGN on your first try. You are not being properly guided. You are just pretentious. Mamaru ka. Wag mamaru. Okay? Okay. So let's move on. At least now you're realizing hindi kailangan ng pagiging mamaru. Okay. So, let's add some more knowledge to those concepts which we have learned so far. Okay? Are you learning, colleagues? Tell me, yes or no? Are you learning? Yes. Okay. So let's have another sample NGN style question. Which of the following phone calls made on behalf of the clients described below should the nurse return to first? Okay. 61-year-old complaining of loose, watery, non-bloody stools. 15-month-old with a temperature of 103 degrees Fahrenheit and diarrhea. 81-year-old with cool, sweaty skin and diarrhea. An 8-month-old with less intense vomiting and diarrhea for 4 days. Now, the question is, do you even know how to answer that question? Not without a functional concept. If you are given questions such as that, all of them are dehydrated, all of the options have diarrhea. This is what you have to remember, functional concepts. One of the priorities in telephone triage includes unwell infant over unwell elderly. That's the first thing you have to look for. Why? Because infants have higher amount of water in their body in relation to their weight, which means dehydration is therefore more severe in infants because they have more fluids or more water in relation to their body weight, approximately 90 to 100%. Elderly clients have only 50 to 60% of their body weight dependent on the water content in their body, which means dehydration is less severe in terms of its effects in the elderly. Or in Tagalog, we say, hayaan mo nang matuyot ang matanda. Okay. Okay? Let the old patient dry out. So it simply means, okay, which one should we prioritize? Remember the functional concept. Unwell infant over unwell elderly. Okay. And then, what do we do next? Due to higher body water proportion in relation to weight, infants are more prone to severe dehydration than older clients. That's a functional concept. So the only thing, therefore, that you have to look for is look for the infant. And the infant is your priority. You don't have to analyze each of those options one by one, and then you end up getting more confused because you don't have a functional concept to focus and to use as a basis for your answer. Okay? Okay. Let's go back to the question now. Which of the following phone calls made on behalf of the clients described below should the nurse return first? Give me an answer based on our functional concept. Go. Excellent. Now you're answering with certainty, with confidence. It's number 4. And what did we look at? Just the age, colleagues. Just the age. Okay? You know what you are doing? If you don't have functional concepts, you are analyzing this one by one. You're trying to rationalize this as if rationalization would bring you the correct answer in a snap. Remember, when you're taking the NGN, time is your primary resource. So you don't waste your time reading all of the details that doesn't give you an idea to the correct answer. Honestly, let's do real talk. This is how you do it, right? You rationalize each and every one of these. And then you remember your college professor who did not even pass NGN teaching you this. Okay? Pag hindi dapat specialty, hindi pinapangasahan, how dare those people? Okay? Okay. So the answer, therefore, is excellent. 4. An 8-month-old with less intense vomiting and diarrhea for 4 days. If you are asked why, because I have an infant. Infants have higher amounts of water in their body. Therefore, dehydration in infants is more severe. And so I have to return the call related to a dehydrated infant over the phone calls related to the other patients who are older. That's the way it should be. Okay? This is not how we were taught in nursing school. Okay? Okay. Kasi, kung lumang tao ang nagtuturo, what do you expect? Okay? So, let's move on. Sinasapian na naman ako ni Miriam. Which of the following interventions is the best way to prevent development of rotavirus infection in a client? Okay, first, I challenge everyone without a functional concept. What do you think is the answer to this question? Come on. The first thing that comes to your mind. Go, 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 go. You see? You see? You see? You still have the NLE mindset. What? You are choosing ang punyetang hand washing dahil yan ang tinuro sa'yo. Gaga. Okay? Let go of that NLE mindset. Hand washing, hand washing. Okay. Use your functional concept. Immunization is the best way to prevent development of an infectious condition. The keyword, development. If you're talking about development of infectious condition, it's in only immunization. While hand washing is the best way to prevent spread of infection. So if your question is about spread of infection, by all means, answer the only concept that your professor in college taught you, hand washing. From second year to fourth year, hand washing pa rin. See? Don't be pretentious, colleagues. I know how it feels. Because if you are being taught the way how things are 30 years ago, you have become a caveman in terms of your ideas. Okay? So let's move on. NLE, NLE. Hand washing, hand washing. Okay. So, analyze. Which of the following interventions is the best way to prevent development of rotavirus infection? The answer is only one. That's immunization. Okay? Now you are more certain because you use a functional concept. That's the way things should be. Okay? Okay. So the best answer is number 2. Excellent. Okay, now, let's try another one. Here we go. Here's the trend. Infection control. In caring for a client with rotavirus infection, once again, rotavirus infection, think diarrhea, think urine output. Best way of preventing it, think immunization. Best way of spreading it, think about hand washing. Which isolation precaution should the nurse implement? Once again, this is select all that apply. Isa lang ang sinasagot mo. Kangangahan. Okay? So, here we go. Clients with rotavirus infection or norovirus infection, this is an update from Centers of Disease Control, must be placed on contact plus standard precautions. In fact, for the first 48 hours, you have to strictly implement contact precautions. And for contact precautions, you need your gloves and your gown. But if your patient has explosive diarrhea and the virus could become airborne through droplets, you also need your mask. It does not necessarily mean that since you will implement contact precautions, you only need your gowns and gloves. It would depend on the concept contained in the question. Okay? And somebody's saying, my soul left the group chat. Scary sumagot. Okay, you are in a class of Ray Gapus. I have 32 years backing my expertise in terms of NGN. No one has done that. No one has monitored the test. Okay? So how dare them pretend to be experts? Okay? Here we go. So therefore, when we answer this question, it's select all that apply. So what do we answer now? We implement standard and we implement contact precautions. And then the mamaru professor would say, standard precaution is appropriate because you have, no. Show me the document. Show me the document that you pass NGN before I believe you. If you have not passed the test that I've passed, then, sorry ka, makinig ka na lang sa akin. This is my expertise. Okay? I eat it for breakfast. I dream this at night. Okay? Here we go. So, may I congratulate before we proceed any further, Miss Martha Carmela Isabel Sales from Mariano Marcos State University, kasama kong Ilocano yan, who passed the NGN for the New Mexico Board of Nursing last March 7, 2025. That's just a couple of days ago. Congratulations. Let's learn from her success recipe. Okay, this is Martha's success recipe. Having a support system was definitely one of the reasons I passed NCLEX. I didn't want to let anyone who believed in me down. And most importantly, I didn't want to let myself down. Learning with RAGRS really helped me keep my cool during such a nerve-wracking exam. Sitting in front of that monitor feels less like walking through a minefield. So what you're saying is less like walking through a minefield and more like taking a hike to somewhere familiar. She was just being poetic. What she wants to say is because of the program that she underwent through the system, the test became so familiar. It was almost unbelievable how on point the topics discussed during my review were. I'm not the one saying. This has been the feedback ever since. It was almost, let me read that again. It was almost unbelievable how on point the topics discussed during my review were. I'm eternally grateful for my loving family, my closest friends, and of course, the RAGRS mentors for being my pillars and cheering me on. So this is Martha Carmela Isabel Sales, USRN from Mariano Marcos State University, the same school where I finished my high school. Okay, so here we go. So before we move further, I told you a while back, I will invite you to an open house. You can use our secret formula. You will experience the way they experience it. They answered questions through our simulators and voila, they knew the trends for the test. But you have to come to the Ray Gapos building where you can use our NGN simulator. Okay, that's going to be for free. You just have to show your attendance sheet for this NGN session. And I'm proud to say I'm here inside our NGN classroom. Yes, this is our classroom. It's squeaky clean. Okay, it's fully air conditioned and soundproof with swivel chairs and individual tables. In the province, we conduct our review at hotels. We don't do it in parking areas, okay? Yes, we do have a fully online review program. We don't do it in aircon-less rooftops, okay? We always give respect to the nurse. You deserve it, colleagues, okay? Wow, so clean, tignan. Very conducive for learning. Meron pa po palang ganito. Of course, this is our main hall, okay? Here at the Ray Gapos building, UN Avenue. Ang ganda mag-try ng simulator. Yes, the simulator could also function as a vibrator. Vibrator of the brain. The simulator is also a vibrator of the brain, okay? Meron po ba online? Yes, we have online, okay? We have full online and our online are not videotape. It's live with me. You can ask me questions, okay? Much needed vibration, sir. Yeah, okay? So, it will also sing to you, la, 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 like that. La, 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 okay? Okay, and our squeaky clean comfort room with bidet tissue paper and diffuser scents, okay? That's how much we respect our students, okay? We give them our best facilities. And of course, they have a lounge where they can take free coffee and biscuits all day long and some treats coming from passers with hot and cold drinking water, okay? Free foods most of the time, yes. Yes, it's buffet because it's coming from those who pass the test, okay? Okay. Ang ganda, ang linis. Of course. Kasi linis ng mga mukha ng mentors ng Ray Gapos system. Walang baku-baku ang mukha sa amin. Okay, here we go. Okay, for those of you who may want to learn about how we do our classes, please do subscribe to my YouTube channel and join our close to 27,000 subscribers. I upload every week and usually the uploads are those that are trending on the test, okay? So our promo, here are our promo, okay? Let me ask our Vice President for Market Development, Efren Gapos Castillejos, and our manager, Miss Joanne Dais, to please help me out, explain our promo. Get a free review from us if you process your nclex-pn application with ITAPS Gapos. So if you process with ITAPS Gapos, you get a free review with the Ray Gapos system. And ITAPS just charges starting package for application for the NCLEX 45,000. No extra charge. Okay? So that's the way how we do it. And of course, we also have low down payment for our NLA review. Now, this has to be updated. We now have 318 top notchers since 1994 with 8 number 1 placers. Okay? Okay. Here we go. And for those on a limited budget, we have 8,800 unlimited next-gen NCLEX comprehensive review with the 85ers. All you have to do, this is unlimited, 8,800. You can join until you pass, okay? With the latest NGN sample questions, and our classes usually start at 7:15 to 9:15 every day, okay? Just 2 hours to help you out. Plus, okay, we also have books like the nursing reminder sheets, which is good for select all that apply, NCLEX 311, the Holy Grail, and the Bible of a lot of passers all around the world. Excuse me, yung mga pang Pilipinas lang ang inotor na libro na otor-otoran. Okay? And of course, nclex-pn Quick Fix in Pharmacology. This comes in full color. Okay? Okay. So, can you help us out? Answer the questions, Miss Joanne. Somebody's asking, ano daw po yung 27,000? How is it different? May 8,800 pala. Okay? So, Ma'am Jo, are you in?
Hello po, good evening.
Yes, Ma'am Jo. The 27,000 is for the full package. You want to see your face?
Hello
Before-
sir, good morning. Good evening po.
That's our very amiable and very charming manager. Okay. So we have a promo, 8,800 unlimited. How is that different from the full package of 27,000? What does it entail? Are
I
they
see.
similar?
Okay po. So, bali po, yung 27,000 po is full package na po yun siya. So, bali meron po siyang books, 3 po yun siya, yung pharmacology, NCLEX 311, yung new edition, and then nursing reminder sheet. And then meron na rin po siyang 3 days po na quick fix. While yung 8,800 naman po
Plus, I
is
think you have a boot camp for the 27,000.
Yes, sir.
Yes, okay.
Pwede po silang mag-sit in doon, sir.
Sa bootcamp. So you don't
Yes po.
have those in 8.8. So the 8,800 is just for the entire review that could be done repeatedly, correct?
Yes, sir. Yes,
Unlimited.
sir.
Okay, so that's the primary difference. If you want more, send us a message and we'll email you all the differences of the different review programs, because we also have a program that starts at 3,499. It's called Quick Fix. Next gen application processing with free review. How is this, Ma'am Joanne? How will they get a free review if they process with iTaps?
I see. So regarding naman po dito, if you process as your application for NCLEX exam, you will get a free review good for 1 cycle. Like for example, you join the month of April. So that month lang po kayo na pwedeng mag-join. Yun naman
So
po.
that's a single cycle. So if you're on a tight
Yes.
budget, you can do that. Okay, and okay, thank you very much, Miss Joanne. Sir Efren,
you
say hi to
po.
everyone, please, before we shift and have our 85er mentor from the University of the Philippines, Manila, do the next concept. So hi, Sir Efren, say hi to everyone, please.
Everyone, good evening po.
Ayan, so we have Sir Efren Gapos Castillejos, our Vice President for Market Development. So if you need help, can ask Efren or Joanne. Now, I'm so proud to welcome our next mentor. She's an 85er, meaning she shut down the NGN. She aced it at minimum of 85 items. And she graduated from the University of the Philippines, Manila. She passed the test last December 4, 2024. Proud to be her mentor. Ladies and gentlemen, let's welcome Mentor Abigail Derillo. Mentor Ab,
Hi,
how
sir.
are you?
Hi,
Okay.
good evening, everyone.
Pleasant evening. Where are you joining us from?
I'm joining from Cavite, sir.
Okay, so you're
Proud
now from
Caviteña. Charit.
And somebody who's also an 85er who would do another concept soon is Miss McLean, who's joining us from Baguio, right? I'm
All
joining
around the
everyone
world,
from
sir.
the Ray Gapos System building here in United Nations Avenue in Manila, Philippines. So take it away, Mentor Ab. I know they would want to hear from you your tips, okay, for the NGN, especially those who are about to take it now. Take it away. Go.
Thank you, sir, for that
Okay,
handover.
Sir George will just shift our control so that you can have a direct control.
Okay, thank you, sir. Good evening, everyone. Nice to see some of you all here. I think some of my students here were also my students in the NLE and the NCLEX program. So hi, good evening. All right. So how do I hi everyone. How do I navigate this one? So please give me some time to adjust. Okay. Ganun lang pala siya. All right. So let's start with our with my portion of the session. So good evening again. Okay, brief background pala on my experience with the NCLEX. So I took the NCLEX on December 2024, and yes, I passed at 85 items. So at that point, I would say I had been reviewing for about a year. And with that, I was also balancing, working sa Gapus. I was also a mentor for NLE, no. So yes, it's very difficult to balance work and reviewing for the NCLEX. So what can I say? Kasi some of you are also, working you have your own jobs, ganyan. The thing about this is that you really have to take the time to review. Okay? What I always advise my students is, okay, di ba we have our YouTube videos, we also have our courses. Those, though our YouTube and our courses have very short videos na you can actually watch a video for 5 minutes even or less. So would you say na ikaw wala kang free na 5 minutes? You don't have free 5 minutes? I always say to my students, 5 minutes, 10 minutes na inallot mo for studying, it is much better than 0 minutes. Okay? So, whether you're employed or not, you need to allot time if you want to pass the NCLEX. Okay? So, this is a what do I this is my tawag dito from a student. She chatted me when she passed the NCLEX. She said, "Hi ma'am, thank you po sa pagsabi sa akin to attend face-to-face quick fix review last March 3 to 5. It's such a big help for me po. I took my exam kahapon and I passed po. Nag-shutdown at 85 questions. Thank you po." So, sabi niya, sobrang salamat po Sir Iga po sa review system. Malaking po tulong talaga yung exam sa simulation po. Nag-second day to build my mind po yung mahabang exam sa madaming SATA. Okay. So the simulation that, Sir Ray has been repeating on over and over again, this is actually accessible through when you go to our office in Manila branch. So yung simulation is basically there's like 8 exams, and then you will have a lot of questions. You'll get like 100 questions for each simulation. So tingnan na lang natin kung di dudugo yung utak nyo sa kakabasa ng question. So that's why I told her, mabuti po man pang mental endurance kasi talaga yung sa simulation kaya siya mahaba. You need to go to the NCLEX. Okay? When you go to the NCLEX, you need to build yourself up to, you need to read yourself up to answer 150 questions. Even if your goal is to answer just 85 or you want to shut down 85, that's okay. But you have to ready yourself to answer 150 questions. And that is the point of doing the simulations. Okay? Now, the simulations, they are meant to be long so that you will have some mental endurance. By the time you sit for your NCLEX, you are not necessarily burned out kayo. Okay? Your journey to the NCLEX, it starts from the time you start the review up until tumayo kayo sa upuan nyo when you finish the NCLEX. Okay? So, malaking bagay, it's a big factor, yung mental fortitude ninyo. Okay? So, that is one of the things that we will try to instill in you. And that's why the mentors are here, because we do not just want to provide you with the lectures and the functional concepts. We're also here for you emotionally, mentally, para ready kayo to take the exam. Okay? So, I'm not really seeing the comments here. Paano ba ite? Okay, so I think I'll just go with my lecture now. So I think I'll just be reading the comments later. All right, so let's start. Okay, so we have another portion of the NGN exam. This is what you call a bow tie. Okay, so a bow tie, it looks like this. So in the middle, may makikita kang condition. Okay, so that condition is what is the question. The NCLEX will be asking you, what is the diagnosis of your patient? Okay, so that's the diagnosis, and then you will be asked to identify 2 actions to take or 2 interventions. Okay, you will have two priority interventions, and then you will have also two parameters to monitor in relation to the intervention that you just did. Okay? So, how does the point system for this work for the bow tie? Okay? Basically, it works by ano tawag dito? The point system for this is for every correct answer, yung isang point for diagnosis, isang point for one action to take, another point for another action to take. So the whole bow tie is actually 5 points. Okay? So when you see a bow tie, galingan nyo sa bow tie kasi kasi malaki ang points na makukuha nyo sa bow tie. Okay? So baka sabihin nyo, hindi naman ako familiar sa ganyan. Well, that's why Sir Ray has been telling you, you leave the NLE mindset already because you're now preparing to take the NCLEX. Okay? This is already NGN. Okay? So ito, 5 points. So imagine how that will lift up your chances of passing the NCLEX. So dapat galingan nyo sa bow tie. Now, when you encounter an NGN item, okay, for example, you get a case study, okay, you will get a case study, then you will be presented an NGN item. It could be in any form. Could be like the matrix that Sir Ray has discussed earlier. Could also be a bow tie like this one. Could be any other thing. And after that, first question in the case study, you will get another 5 questions relating to that case. Okay? So imagine, in this bow tie, 5 points ka na kaagad. So kailangan mo siyang galingan. Okay? Now, oops, sorry. Napapindot ako. Okay. Now, let's have this case study. Okay? Ano, naisip ko ng iba dyan. Oh no, ma'am, may ECG. Okay? So, ganito guys. When you are faced with a type of question like this, nakita niyo ECG agad, huwag kayong didiretso sa fact na, hala, bobo ko sa cardio. Okay? Don't go straight to that. That's very negative thinking. The first thing you should think is, I can do this question. I can answer this question. Okay? Dapat may ganun kayong mental fortitude. Okay. Anyway, let's try to read this case. So please read along with me. Mr. Antonio, a 68-year-old retired teacher, was enjoying a quiet afternoon when he suddenly felt dizzy and lightheaded. He brushed it off as simple fatigue, but over the past few weeks, he had been experiencing frequent episodes of extreme tiredness and occasional shortness of breath. Even while doing simple tasks, like walking to the kitchen, his family noticed that he would sometimes pause mid-conversation, appearing pale and disoriented. One morning, while getting out of bed, he suddenly collapsed. His wife rushed him to the emergency room, where doctors noted that his pulse was alarmingly slow and irregular. An ECG revealed this. This is the ECG reading of your patient. Okay? And the description of the ECG reads as follows. The QRS complexes have a regular rhythm. The P waves are present and occur at regular rate, but they have no consistent relationship with the QRS complex. Accomplish the bow tie questions that follow. Okay? Ma'am, ang dami. How do I get through this case study? Okay? So, again, this is what your bow tie will look like. The question will be asking you for a diagnosis, one diagnosis. You will be asked 2 actions to take and 2 parameters to monitor in relation to the intervention that you described or the action that you wanted to take. Okay, so imagine, kung mali na ang action to take o kung mali na diagnosis mo, okay, if your diagnosis is incorrect, it's possible for you to get wrong the action to take and also the parameters to monitor. That's why the bow tie item is heavy. Okay, but if you get it right, it increases your chances of passing the NCLEX. Okay. Now, how will we get through this item? So I would like to go back to a few sentences here. Okay. So let's go to the description of the patient. So he said, let's look at the second sentence. Okay. He brushed it off as simple fatigue, but he had been experiencing frequent episodes of extreme tiredness and occasional shortness of breath. So you might be thinking, okay, one of the symptoms the patient has is shortness of breath. Patient also has fatigue. And if you read through the rest of this case, that is it's consistent with what's said in the second sentence. Okay. One morning while getting out of bed, he suddenly collapsed. Okay. Now, let's look at the ECG. Okay. Now, in this ECG, if you do not know how to read it, it might look like it's very much normal. Okay. So, but in this one, this is actually what you call a complete heart block. Okay. Ma'am, how did you say it was a complete heart block? Basically, your heart block has 3 degrees. Okay. You have first degree, second degree, and third degree. Third degree, that's the complete heart block. Okay. Now, your first degree and second degree, basically, there's just a problem with the conduction of the impulse. Okay. And what happens is the heart rate slows down. Okay. There's a bit of a delay, therefore the heart rate slows down. Now, what is the difference between the first degree, second degree, and the third degree? The difference between the first degree and second degree to the third degree or complete heart block is your first degree and second degree, your atria and your ventricles are still in sync with their contractions. Okay, so what I'm trying to say is if the atria contracts, the ventricle also contracts. Okay, it's just a bit slow. But when the third degree heart block or complete heart block, okay, what happens is the atria may contract, but the ventricle does not immediately follow. It will take some time. Basically, the contraction of the atria and the ventricles are no longer in sync. Kumbaga sa mag-asawa, sila daw ay hiwalay na. Okay? Ganun daw sila. Okay? Now, the description of a complete heart block, okay, is in this concept. Okay? So remember this concept. The hallmark of complete heart block on ECG is the presence of atrioventricular dissociation. That's what I mean. So they are not in sync anymore, meaning the P waves are present and occur at a regular rate, but they have no consistent relationship with the QRS complex. Okay, I just realized I can write on the slide. So let me try to write here. Okay. Ayan. Okay, wait. Let me just try to adjust. Okay. Ay. Let's have a pen. Okay, yan. That's a lot better. Okay, so let's go back. Ma'am, what is the P wave? Your P wave is here. Okay, your P wave, it should always precede your QRS complex. Now, what does the P wave signify? P wave signifies atrial contraction. Okay, your QRS signifies ventricular contraction. Now, the thing is, the normal P wave should always precede the QRS, and the QRS should always come after the P wave. Now, what happened here is, okay, if you look at this properly, okay, ayan, please bear with me. Okay, so if you look at this properly, you have here a P wave, okay, followed by a QRS, so that seems normal, okay? But if you look at here, there's another P wave over here, but that is not what is supposed to happen. Remember, your P wave should always come before your QRS complex, okay? Then you have, look at this one, you have a P wave over here that is very far from your ventricle. So this is what you mean by dissociation between your P wave and your QRS complex. So right now it may be a bit of complicated, okay? But all you have to remember is the functional concept. Okay, so let me just erase the ink. Okay. So going to the repeating the concept, okay? So in complete heart block, the P waves are present and occur at a regular rate, but they do not have a consistent relationship with the QRS complex. Okay? So you are now asked the bow tie question. Okay? So this is what your bow tie will look like. Okay? So you will be asked to make your diagnosis, and you'll be asked you will be given 4 options. Okay? So first you have first degree heart block, you have sinus brady, second degree AV block, and complete heart block. So what did I say? The answer, the diagnosis of that ECG is actually complete heart block. So that is what your bow tie will look like. Okay? Now, second, okay, thing that we need to accomplish, we need to identify 2 actions to take. Okay? So, you have the list of actions: transcutaneous spacing, administer digoxin, administer atropine, and or you give your epinephrine drip. Okay? Now, all of these things can actually be helpful for complete heart block. Okay? Except actually for digoxin, because that could actually slow down the heart rate. But how do we answer this question? So again, okay, we do our functional concept. Where's the concept? Okay. Oh, it's not here. Okay, anyway. Okay, so how do we answer this question? Okay, the priority for addressing complete heart block is you do these 2 things. Okay, so what's the concept between your transcutaneous spacing and your epinephrine drip? Okay? Your transcutaneous spacing, okay, this will aid in the conduction of electrical impulses. Okay? So remember what I said in complete heart block, there is a problem with the conduction of the electrical impulse, and that's why the heart rate is very slow. That's why the atria and the ventricles are not contracting in sync. So therefore, we need to do our transcutaneous spacing. So that is the first intervention. Okay? Now, the second intervention, the priority for patient with heart block is to give your epinephrine drip. So please excuse that. That is incorrect. The correct answer is this one. Hindi lang napalitan. Okay? So, your epinephrine drip, it can also actually increase the heart rate of your patient. Okay? Now, with your patient, okay, who is having complete heart block, you can actually also expect that their blood pressure will also drop. Okay? That's why in the case earlier, di ba nag-collapse yung pasyente? Okay? So it's possible also because of the drop in the blood pressure. Now, with your epinephrine drip, okay, you will need to monitor some certain parameters as well. In epinephrine, you need to monitor the patient's vital signs, particularly their heart rate or their blood pressure. Okay? Now, with transcutaneous spacing, what do we need to check? Remember, it will aid in the conduction of electrical impulse. So what tests are we using to aid in the use of checking if the electrical impulses are normal? That's what we call your ECG. Okay? So, next, we have your parameters to monitor. Okay, so what parameters are we given? So we have 1 ECG, 2 urine output, 3 respiratory rate, and 4 heart rate. Okay, so as we said, okay, you have this list of actions to take. Now, when you are going to put it here in the parameters to monitor, your action should be connected to these parameters. Okay, dapat magkahilera sila. Okay, so, what should we use to monitor if your transcutaneous spacing is, oops, sorry, what happened? Okay. Ay, nakakaloka. Anyway. Sorry. I must have clicked something. Okay. So, what can we use to monitor? Okay, if the transcutaneous spacing was effective, it's going to be your, okay, it's your ECG. Okay. Let me wait for the, okay, yes, so there you go. So transcutaneous pacing, you need to check the ECG to see if the pacing was effective. So what will you expect to see if the transcutaneous pacing was effective? So you will see that the P waves now and the QRS complexes are now in sync. Therefore, your atria and your ventricles are now in sync with their contractions. Okay? Next, with your epinephrine drip, what can we expect to monitor? So you will need to monitor, like I said, you can monitor the heart rate or the blood pressure. But in this one, you are given heart rate. So that's what you will put here. Okay? You monitor the heart rate. Okay? So that is how you will answer your bow tie item. So again, this is your final answer. Complete heart block. Okay, the actions that you will take, transcutaneous pacing and epinephrine drip, and parameters to monitor are electrocardiogram and your heart rate. Okay? So there you go. Now, when you are given an NGN item, especially if it's in a case study form, you will be asked actually a total of 6 questions for each case study. Okay? So you will be asked according to ADPI. Okay? The nursing process. You have assessment, diagnosis, planning, intervention, and evaluation. So doon lang siya umiikot. Okay? So, the follow-up question to that case is, which of the following factors should the nurse need to focus on when determining the potential cause of the client's condition? Okay, so in complete heart block, okay, remember this concept as well. Okay, elderly patients with digoxin toxicity often present with nausea, vision changes, or yellow vision. So this is what we call, let me just spell it out. Okay, try kong magsulat. Okay, the vision changes, also known as yellow vision, ang pangit ng sulat ko. Pasensya na. It is what we call xanthopsia. Okay? Xanthopsia. Sorry, I'm writing with my mouse. Pasensya na. It's called santopsia. So this is when your patient looks at something and then it just appears yellow or green. That's what they see in their vision. And what they usually complain about is that the TV will look weird. But then as a nurse, when you look at the TV looks normal. So there is a problem with the patient's vision. Okay? That is what you call santopsia and complete heart block. So if an elderly client is taking digoxin and they develop digoxin toxicity, they get these symptoms. So nausea, vision changes, and complete heart block. Now, going back to that question, okay, which of the following factors should the nurse need to focus on when determining the potential cause of the client's condition? So therefore your answer based on that concept is number 3. Okay, it is digoxin toxicity. Okay. Now let's have another question. Which of the following clients is most at risk for developing a complete heart block? So you have the following options. 16-year-old with anorexia on quetiapine, 78-year-old with dementia on donepezil, a 67-year-old with COPD on salbutamol, and a 37-year-old with anemia on ferrous sulfate supplement. So if you are aware of these drugs, okay, these drugs are actually in line with the disease that they are supposed to be managing. So yes, quetiapine, you can give it for anorexia. Donepezil, you can give it for dementia. But that is not what NCLEX is asking you for, okay? It is asking you who is most at risk for developing a heart block. Now, if you don't know your pharma, you will not be able to answer this question, okay? Now, with this concept, okay, you will get to answer it. So, what are the drugs that can increase risk for complete heart block? They are your pilocarpine, donepezil, and your neostigmine. Okay, pilocarpine. This is a drug given to manage glaucoma. Okay, so that's an eye problem. Donepezil is actually given for patients with Alzheimer's disease and some cases of dementia. Neostigmine, on the other hand, is given for patients who have myasthenia gravis, which is a neuromuscular disturbance. Okay, so knowing this concept, you will be able to answer the question again. Okay, so which of the following is most at risk of developing a complete heart block? Okay, so the correct answer is number 2. Okay, a 78-year-old with dementia on donepezil. Okay, so I think that is the end of my portion. Okay, I'm sorry I can't really see the chat box. I would like to be able to engage with you all. So maybe pag nag-ano na yung next mentor natin. Okay, so sorry na pindot. Spoiler. Okay, pasensya na po. Okay, so thank you everyone for listening to my portion. I will now be introducing our next mentor. So she is a graduate of Pines College. Siya po ay talagang tubong norte. Okay, ang ating napakagandang si Miss McLean. Miss McLean, are you here?
Yes, I am here.
Bongga, di ba, ma'am?
Correct, correct, correct. So, hi everyone. I cannot see my face actually. And then I cannot even see the chat box nga as you mentioned kanina. So, really don't know how does it work. Paano ba to? Ayan. Sir George, paano ba to? Ayan. So, I do not know. So, I cannot see the one niya pinipindot kanina ni ma'am for the at the side. I don't know. Ayun, nakita ko na. Ayun. Ayan. So, hi, by the way, my name is Mentor McLean. So, as you can see, I did pass my NCLEX. I think it will be 2 years from now. So, I am also a certified 85er. So, just a background for those who didn't know me. Actually, we were the first batch to take the NGN. So, the NGN started at April. So, I took mine by May, no? So luckily, I did pass my exam at 85th question confidently with a heart. Charot lang. So confidently beautiful with a heart, yes. Ayan. So as you can see, that was my picture taken when I did graduate in college. So maybe you might be wondering what happened to my hair. No, those were my lesbian days. Ayan. Yeah, those were the days that I was actually a lesbian yan. Charot lang. Okay. So, yes, so I am also the success advisor of the RAI Gapo service system. So for those who knew me already, and then those who passed their exam, actually, we did together with Dr. Reno, we also plan or we give study guides for our test takers prior to their exam. So at least remember in the Reigapos review system, no, we always make sure that no one is left behind so that every member is part of our growing family. Okay? So it's nice to meet everyone. For those, I think I have students here before sa local boards. And then for those new, hi everyone. Ayan. Hi, Mentor Jimmy. Okay, so paano ba to? Ayan. Okay, so these are my students' feedback. So how they aced the NCLEX exam. So let me just read it to you parang maliit, no? Hi, Miss. It's exactly a year that I ended my review class with Ray A. Gapos. As I reflect on my NCLEX journey with Gapos, I am extremely grateful for your knowledge, motivation, and wishes during the classes. I am deeply indebted to you, a young, beautiful, and brilliant mentor like you. I'm not just happy for being USRN, but I am inspired to dedicate myself, knowledge, and personality to inspire young RNs. Thank you, Miss. And then even ask him, when did you take your exam? So he said he took his exam November 2024. And then I did ask him, what helped you the most about our review? So according to him, it's about the functional concepts. Remember, in our system, it's unique, no? Because we use our functional concept like most of the time to guide students on how to answer question. And then according to him, it was a game changer, especially with infectious and infection control by you. So I also teach infection control. And then so I did ask him, did you attend the quick fix? Yes, on early November. So I think he only joined one quick fix and then joined the comprehensive review. So I had some questions directly from the quick fix. O see, siya na po ang nagpatunay, hindi po ako. Okay? So the quick fix was useful for the case studies. And then that's just from one student. So other one says, Mama McLean, salamat sa study guide. Thank you for the study guide. It's very helpful. Plus, the last minute tips a day before my exam given by Dr. Ray. Yes. Ayan, no? So, yes, no? So, take note in our sessions, we usually do sermon din, no? It's not just about, just teaching you. It's about you getting inspiration from us, your mentors, no? Because I know for a fact that you are doing this not just for your own sake, you do it for the sake of your own family. So that's why we really have to, keep ourselves motivated and focused and aim for that. What? USRN dream and live by that dream. No? Ayan. Okay. So, ayan. So, pag ako ang mentor nyo, if I am your mentor, actually, we usually waste around 15 minutes on the introduction just to give you inspiration and motivation to keep pushing further. No? Regardless of either, there are times that you feel bad about yourself or there are times that you feel like giving up. No, it's not about giving up. It's about, remember, do not ever quit, okay? Okay, do not ever quit. Because remember, what is the opposite of success? It's not failure. It's about, no, the opposite of of success is not failure. It's about quitting. So don't ever, ever quit. Okay? Yan. Okay. So the example of an NGN question. So this is your MR grouping item. So basically, I also had this one when I took my exam. So what do you need to remember on this one is that be particular that sometimes they would ask you group of signs and symptoms within a specific body system. Okay. So take note the latter part at the end part. Note each category must have at least one response option selected. Okay. Yes, you have to do that. Okay. And take note the scoring here would be right minus wrong. Yeah. So for example, if you have four correct options and then you take one unsure and then that's a mistake, then definitely you will get a deduction. So be careful with your MR grouping item, unlike your bow tie, because your bow tie is an independent scoring. So regardless of either you do not get the diagnosis, it's fine. But for your MR grouping, you need to just select what you are sure of and take note. Remember to select one per system. Okay, so let's go on or move on. Okay, so click to highlight below three manifestations that reflect the target symptoms of your haloperidol. Remember, your haloperidol is a neuroleptic medication. So when you talk about neuroleptic medications, these are medications that would help address symptoms of psychosis. So in short, your neuroleptics are also known as your antipsychotics. Take note, your haloperidol falls under your first generation antipsychotic. So when we talk about your first generation, example of other first generation antipsychotic would be your chlorpromazine. Okay. So those are two famous typical antipsychotics. We have your haloperidol and your chlorpromazine. So, but pay particular attention when we talk about your haloperidol or haldol, take note that your typical antipsychotics only address positive symptoms of your schizophrenia. So when we talk about your positive symptoms, these are abnormal perceptions, experiences, hallucinations that is felt by your patient. So something that has been added to your patient that they experience. Okay, that those are the your positive symptoms. So other than that, so let's go over. So what do? We teach our students to remember positive symptoms of schizophrenia. So we have the code DH lawak, no? So D stands for delusion. Okay, usually the most common would be either persecutory delusion or delusion of grandeur. Next, you have your hallucination. Okay, it could be visual, it could be tactile or auditory. Next, you have your looseness of association. So basically, they don't relate at all. That's your looseness of association. Next is we have your ambivalence. A. Ambivalence. Ambivalence means the presence of two opposing feeling. A person would say, "Oh, you know what? I hate my husband, but I miss him so much." See? Two opposing feeling. That's ambivalence. Then we also have your word salad. So, mixture of words that does not make sense. Okay, then we have your agitation. So agitation is a combination of your anxiety plus restlessness. And then we also have confusion or disorientation. Okay, so remember, your haloperidol only addresses your positive symptoms. So I did mention a while ago, we have your DHLAWA C. So we have your DH lawak. So delusions, hallucination, looseness, ambivalence, word salad, agitation, and confusion. So let's go over with our sample question. So take note, remember, in the NCLEX, they would give you all the necessary information. So you don't need to guess. Okay. And mind you, when you are faced with this type of question, usually all the possible answers, okay, or the choices are typically clickable. Okay, ibig sabihin napipindot siya. Okay, kaya pag ang napipilit mo ay pinipindot mo ay hindi nakiklik, wag mong ipilit, mali 'yon. Okay? So that's what I'm saying with my colleagues, no, especially taking the exam. If it is not clickable, do not attempt to click because it simply implies that that's incorrect. That's not part of the option. But here, of course, in the Reigapos review system, we want, basically, some students would say it is more difficult, no, especially in terms of our examples. It's way difficult in the Reigapos review system. So that's why when they take their exam, they would say, yun na yun. Yan. Ewan ko yun ang mga sinasabi nila. Ayan. So let's go over, no? Okay. Remember, DH Lawak. Okay. Thank you, Mentor Jimmy. So the client tells the nurse, everyone kneel before the presence of thy queen. Is that an example of delusion of grandeur? Yes. So do we click that? Yes. Okay. And then says, who whispered my name? I'm hearing it. Or is that form of your hallucination? Do we click that? Okay. Do we click that? Yes. Okay. Okay. When no one called, she then proceeds to greet everyone good morning. Take note, it's 10 p.m. No? It's already 10 p.m. Then, she said rather, good morning. So is there confusion or disorientation? Yes. So, do we need to click that? Yes. Yes. So take note in your NCLEX as well, in your click to highlight things, usually they would tell you how many things to click, or there are certain options that it will not include how many descriptions you have to click. So be very careful with this one. Okay? So if, for example, the question would ask you, click 3 manifestations that reflect the target. So click only 3 or any options or clickable passage or words or phrase that you are sure of. Because this is, if I'm not mistaken, this is right minus wrong. Okay? Okay. Okay. So let's go over with, so we are correct. So remember, your positive symptoms is only addressed by your typical antipsychotic, specifically your haloperidol or your chlorpromazine. Okay? Ayan. So take note, if a patient is taking in, like, for example, your typical antipsychotic, it is usually common for them to experience your extrapyramidal symptoms. Yes. So later on, we will discuss what is the most common extrapyramidal symptom that the patient may experience. Okay. Okay, so in a client with schizophrenia, which of the following are considered your positive signs? So I did mention a while ago. Okay, so before we answer that, let's have first a functional concept. So remember, positive signs of schizophrenia refer to symptoms that involve, take note, an excess. So meaning in addition. So these are conditions, like for example, your abnormal perception, okay, abnormal thought that a patient would experience, okay, leading to distortion of normal function. Okay, this is your positive symptoms. So we did mention a while ago, your delusions, hallucinations, looseness, ambivalence, word salad, agitation, and confusion. Okay. So if you are asked again, so which do we need to select? Positive symptoms, delusion? Yes. Apathy is considered to be your negative symptom. When you say apathy, so lack of interest. No? Okay. So next we have ambivalence. Yes, that's the presence of two opposing feeling. Hallucination, correct. Confusion, yes. And then we also have your alogia or poverty of speech. So common negative symptoms of schizophrenia, we have your 5 A's, no? We have your apathy, alogia, asociality. Okay, we also have your anhedonia, and we have your asociality or avolition rather. So there are 5. Okay? And usually, for example, if for example you are concerned of addressing both negative and positive, okay, usually the drug of choice would be your second generation or your atypical antipsychotics. Usually the best example would be your clozapine. Okay, clozapine for your both negative and positive. Okay, take note. But if a patient is taking in your atypical antipsychotics, usually they have to watch out for agranulocytosis. So how would you know if a patient is experiencing agranulocytosis? Look for their blood works. So there would be evidence of decreased WBC and decreased absolute neutrophil count. Okay, so that is for your antipsychotics or your neuroleptics. Okay, so let's go over which of the following clients suffering from schizophrenia should the nurse attend to first? Okay, so when you see the word a nurse attend to first, so meaning they are developing complication that needs or warrants immediate attention. Okay, but before we answer that, let's have first a a functional concept. Yan. So the initial sign of your neuroleptic malignant syndrome or your NMS in a patient taking antipsychotic is usually high fever, altered mental status. You can also add your muscle rigidity or even diaphoresis. Okay. Take note, okay, management of your neuroleptic malignant syndrome would include 4 or following drugs. So we have your code BALD, no? B A L and D. Okay. So first, we have your bromocriptine, no? That's the drug of choice for patients with neuroleptic malignant syndrome. Next, we have letter A, amantadine. Then L, lorazepam. Then D, we have your dantrolene for muscle rigidity. I repeat, these are common medications given to patients with NMS. So we have your bromocriptine, amantadine, lorazepam, and we have your dantrolene. I repeat, okay? Don't forget your BALD. Okay. So let's go over. Remember, high fever, altered mental status, muscle rigidity, diaphoresis, confusion, agitation. That could be an indication of your neuroleptic malignant syndrome. Okay. Usually, your neuroleptic malignant syndrome is caused by your antipsychotic. So because sometimes in the NCLEX, you would also see similar manifestation, no? I don't know if you're familiar with your serotonin toxicity, because sometimes the symptoms of your serotonin toxicity and neuroleptic malignant syndrome are overlapping, no? So you could mistaken neuroleptic malignant syndrome with your serotonin toxicity. So take note, they are usually the same signs and symptoms. So what sets them apart? It would be the type of medication the patient is taking. So if, for example, the patient is taking in antidepressants, okay, and then they develop muscle rigidity, high fever, and altered mental status, that is an indication of your serotonin toxicity. But if the patient is taking in antipsychotic and they experience muscle rigidity, and then we have diaphoresis and increased temperature or high fever. That is neuroleptic malignant syndrome. Okay? Don't forget that, my dear colleagues. It's trending in the NCLEX. So therefore, let's go over and go back to the question. So which of the following clients suffering from schizophrenia should the nurse attend to first? So looking back, so if the moment you see high fever, okay, and they're taking in your neuroleptics, that is an indication that the patient is experiencing neuroleptic malignant syndrome. Okay, so what are the medications? So we have, of course, we need to stop the neuroleptic medication, and we have to give your bromocriptine, amantadine, lorazepam, and your dantrolene. Okay, so you are doing great. Ayan. Okay, so the correct answer is number 2, a temperature of 38.7, and he's taking your antipsychotic. Okay. So a 37-year-old male with schizophrenia who is taking an antipsychotic drug tells the nurse, "My breasts are producing milk." Ay, ano kaya yan? Is that a form of delusion? The nurse should document this statement as reflective of what? Okay. But before we answer that, let's have first a functional concept. Okay. Side effects that are common with typical antipsychotics. So remember, okay, we have your haloperidol, and then we also have your antipsychotic atypical. We have your risperidone, includes galactorrhea, so abnormal milk production, and of course, gynecomastia, so breast enlargement in males. So the moment you see that a patient is experiencing gynecomastia and taking in your neuroleptic medication, so that is a normal finding. Okay, so let's go back and try to answer. So a 37-year-old male, so therefore, what is our answer? Is it the form of delusion, hallucination, an expected outcome, or a toxic effect of the drug? So remember, usually, what are the toxic effect of the drug if they would experience high fever, correct? So that is an expected effect of the drug. Okay, correct. Okay, let's go over. A 37-year-old male with schizophrenia always tells the nurse, "I am the greatest monarch of all time." What is that? Is that delusion? Delusion of grandeur, correct? Okay, the nursing diagnosis related to this statement is which one of the following? Okay, so take note, when a patient is or experiencing schizophrenia, okay, usually they have, remember, there are alterations, no? On the way they think. Ayan. Okay. Before kayo sumagot, itsusera kayo. Okay. So, syempre, we always have to use your functional concept before we answer the question. Ayan. So, disturbed thought process is evidenced by persistent false belief or your delusion. Okay? So, remember, the first thing that you have to do if a patient, okay, question, what is the first thing that you have to do if the patient has delusion? Remember, forget the NLE mindset. Do not present reality right away. What do you need to do? Assess the importance of the delusion. Correct? Do not say, present reality. Gaga. Okay? You have to assess the importance of the delusion. If it is important, okay, and if it's not, then that's the time that you need to present reality. Okay? Ayan, itsusera kayo. Ayan. Okay, so let's go back. So I am the greatest monarch of all time. So what is the appropriate nursing diagnosis? Okay, so for example, kunyari, if for example, the question would say a patient with paranoid schizophrenia, okay, or catatonic schizophrenia. Okay, usually they might have impaired social interaction. For risk for self-directed violence, it could be paranoia, paranoid schizophrenia. Okay, if the patient would say, if the statement would say there is extreme suspiciousness, it could be your risk for self-directed violence. So in terms of your self-care deficit, if for example, they cannot take care of their hygiene, it could be an example of self-care deficit. But since the statement is asking and it is presented that the patient said, I am the greatest monarch of all time. So that is an indication of your disturbed thought process. Ayan. Pag for example, the patient might have hallucination, so appropriate nursing diagnosis would be disturbed sensory perception. Okay, I repeat, if the patient has hallucination, it's your disturbed sensory perception. But if it is more on delusion, it's more on disturbed thought process. Okay, don't forget that because sometimes now test takers might confuse disturbed thought process with your disturbed sensory perception. Okay? Ayan. Ayan. Okay, so let's go over to our last question. When assessing a client with schizophrenia, which one of the following indicates improved thought process? Sasabihin na naman yan. Ability to distinguish reality from delusion, gaga. Diba? Yun na naman ang sagot ninyo. Tama ba? Okay, so that's why it's very important for our student that they should get accustomed to our functional concept. Ganun! Kasasabi ko lang, Mika, mali nga yung number 4, ay number delusion. Ito, Sarah. Okay. So let's have first your functional concept before we answer our question. Ayan. Okay. So remember, improved social engagement is evidenced by a client's ability to interact positively with friends and family. That's correct. It's something to do with your social engagement. Okay, the ability to talk, okay, or even positively engage with your friends and family, even the nurses correctly. Yan. Okay, next. Emotional stability is evidenced by less agitation in the client. That's correct. So that's something to do with regulation of your emotion. So meaning they are less agitated. Okay. Okay. So how would you know if the patient is less agitated? If you see them resting or there are reduced moments of, pacing back and forth. Yan. Next. So reduction of psychotic symptom is evidence, or remember, that's the word. Reduction of psychotic symptom is evidenced by the client's ability to distinguish reality from delusion. Okay, remember, that is for your reduction of psychotic symptoms. Not necessarily entirely na mawala yan. Okay. So therefore, improved thought processes and insight is evidenced by the client's ability to recognize their triggers and symptoms. So ma'am, what are possible triggers or symptoms? Like for example, insomnia. Okay? It could be an indication of, okay, of your triggers or even symptoms. Ayan. So aside from your insomnia, it could either be that they would complain of what? Okay. They would complain of your, for example, you would see that they are trying to neglect hygiene again, or maybe if they have complaints of difficulty concentrating, okay? If they have having decreased motivation, this could be an indication that they are having improved thought process if they are able to identify the triggers and symptoms. Okay? So of course, if there would be mood changes, it could be an indication as well of triggers. Ayan. So, let's go back again to the question. So, when assessing a client with schizo, which one of the following indicates let's say, improved thought process? So, that's why it's the ability to recognize the triggers and your symptoms. Correct. Tamang-tama kayo. So, that's why, you know what? I do encourage my students to really join the comprehensive review now because technically you will now then get to accustomed to our functional concept. So by the moment you see the question, at least you have a stored knowledge in mind on how to attack the question. Okay? So I think that's it. That's the end of my portion. So okay, basically, ang sabi nila dito, okay. So, I think we have to raffle 5 NCLEX book. Tama ba? So are you excited with our raffle? So I hope you did learn from my portion. Okay? So take note no, like different mentors have their own different, of course, their own specialty. Now, so, yes. Ayan. Thank you so much. So let's have Sir Efren, if you are there, our VP for marketing. So they will be giving you 5 NCLEX 311 book, yeah, for a raffle. So thank you everyone. Have a blessed day. Sir Efren, take it away.
Sir Eric, okay? First winner. Okay, please screenshot Daniel Santiago and message us in our official Facebook page. Okay, next please. Okay, kung sino ka man po, Nurse Chris, please screenshot and message us in our official Facebook page to claim your book. Next, please. So, sino po si Luisa? Please screenshot again and message us in our official Facebook page. Thank you. Okay, Miss Tanisha, please message us in our official Facebook page and screenshot this. Okay, our last winner, Sir Eric. Okay, congratulations, Harvey. Please screenshot and message us in our official Facebook page. Again, thank you for participating in
Sir
our
Efren, sorry.
pre-lecture.
Ay, sayang. Sir Efren, sabi ni Luisa, thank you, but I already got mine at the office last week. So I think we could just raffle again.
Okay,
Sayang eh.
another one, Sir Eric. Okay, congratulations, Angeline Banaat. Please send a message in our official Facebook page so that we can send the book via LBC. So again, thank you everyone for joining us in our free lecture. Miss McLean, our last message.
I think, yeah, okay. So for my last message, so for those who are aspiring to become USRN, so do not wait your time, okay? So wag niyo sabihin na, it's still retrogression. No. Do it now so that the moment you are now taking your examinations, then definitely, no, you already are a USRN. So take note, stay focused, and do not ever leave your sight with that goal in mind. So to become USRN. So thank you everyone. So I hope to see you in class together with our other members. Can I chat? Yes, you may. Yes, you may. Okay, thank you everyone. So thank you so much.